on a Thursday morning. It's July, what is it, the 6th? Wow. This month is sort of flying by. Fireworks just the other day, 4th of July, and it was a fun event there. And we continue our live segments here in the studio, and we want to welcome into the studio one of our guests, Kara Rose from West Michigan Community Mental Health. How you doing, Kara?
I'm good. How are you?
And is it Kara or Kara?
It's Kara.
I thought so. Okay.
Yeah,
I'm like,
right.
I want to make sure that I have it right.
Thank you.
Well, thanks for coming in this morning. We like to talk with the team from West Michigan Community Mental Health. Overall, before we even dive into the subject here, it is important for people to know that West Michigan Community Mental Health, the area served, Mason, Lake, and Oceana counties, right?
Yeah, correct.
And overall, before we dive into the topic, which is recipient rights, West Michigan Community Mental Health has become just a leader in the area for people that need that help, that guidance, a phone call if they're in any sort of issue that just needs another person on the other end of the line, right?
Exactly. Yeah.
And services, it is a huge gamut of services that's up.
Very wide array of services, yeah, including crisis stabilization, mental health, substance use disorder assistance. We have therapy, case management, peer coaching. Yeah. We provide a lot of support.
Absolutely. And the reason for all of those services is because just in an area like here, we need those services. When we talk about big cities where there's a huge population and so on and so forth, you can only, the perception is, of course, you're going to need those services. Of course, you're going to need those hotlines and other people at the end of the line. But in our rural areas, we need that just as much, don't we?
Just as much, absolutely. I couldn't agree with you more.
All right.
I think sometimes we need them more.
Yeah, absolutely. Well said. Let's talk about, and over the next couple of minutes, if you don't mind, educating me on the recipient rights. What does that mean?
Okay, so the Michigan Mental Health Code requires that all CMHs and hospital mental health units have a recipient rights officer, which is the role I fill. I called a recipient rights coordinator at West Michigan.
Okay.
Basically, our job is to make sure that all of our staff, all of our contracted providers, their staff are all adhering to what the mental health code says and protecting the rights of every individual that we serve, whether it's in our outpatient settings or our specialized residential settings, generalized AFCs. We make sure that we're taking care of all of our people, and they have the right to be free from abuse. They have the right to be treated with dignity and respect, just like anyone else.
And if somebody were to violate those rights, what happens at that point?
What happens is hopefully someone has observed it, files a complaint with me. Mm-hmm. And then from there, I kind of start acting kind of like a police officer, where I start collecting information. I do interviews with people. I investigate. Mm-hmm. So ideally, I get it done as quickly as possible. But this mental health code says I have up to 90 days to investigate that. And then I don't have the same burden of proof that the police officers would. I have to be able to say that it's most likely that this happened versus it absolutely definitely happened, if that makes sense.
And what do you think the reason behind that is? What's your thoughts? Because, let me just ask that question, if you don't mind.
Well, I think a lot of it is that recipient rights officers come from different backgrounds. Some of us have been social workers or therapists and worked within mental health for a long time. Some of us haven't. I know, personally, I come from an area of work that I never saw myself working in mental health at all. And the fact that I've fallen into it, I've found something that I'm passionate about and enjoy doing.
Absolutely.
And we're not lawyers. We're not police officers. We're not trained in the same techniques that they are or in the same laws that they are. We are very specialized with the mental health code. So.
And so bring us back, before we get too far, bring us through a scenario of where you would step in, from the first steps to the end step, if you don't mind. Bring us through that, if you don't mind.
So generally speaking, if a consumer or a patient had something happen while they were with a therapist at our building, that they felt their right to dignity and respect was violated, that they can call me, they can file that complaint. I would open an investigation or an intervention, depending on whether or not it's obvious that it happened or not.
Okay.
With the investigation, I would be letting the person's supervisor know. I'd be going through doing interviews with the consumer, also with any staff involved. And then from there, I'm comparing my notes to the mental health code, really. I'm looking at which sections of the mental health code would apply to dignity and respect, what definitions within the mental health code apply to dignity and respect, and whether or not the proof that I have supports that this violation happened or not.
Okay. And do you see that people are hesitant to report that? I mean, because when we talk about we talk about privacy, some people they're hesitant because they don't know the reactions or what will happen after that.
Yeah, I to a degree, I don't think it's hesitancy because they're afraid of sharing the information so much as they're not necessarily fully aware of what recipient rights, what our role is within their care, if that makes sense.
Right.
We try to educate and make sure that everybody's aware of us, and if they're given booklets when they first access services, and they're given a brief overview of what recipient rights is. Mm-hmm. But I don't know how many people actually read that booklet, or how in-depth all of us necessarily go all the time when we're talking about it, especially when you're checking someone in, trying to get them into an access clinician to get screened.
Okay. And so what is, I mean, when we talk about Michigan Mental Health Code, mm-hmm. I would assume that the book is pretty big, but can you summarize it for those patients? Because this is what, and so that I'm not too confused here, somebody comes to West Michigan CMH, mm-hmm. They're a patient there. They have obviously rights before they come there, but they have additional rights as soon as they check in as a patient, right?
Yep. So before they're a consumer with West Michigan, I actually am not able to do anything.
Okay.
So that would have to go through a different system. Once they are put into services at CMH, then I can do something if something were to happen.
And that's and when you say that, if something were to happen, that's with a spouse or with anybody that's out there. Again, take us through that process first.
I'm actually quite specialized.
Okay.
So Recipient Rights is really geared toward taking care of our recipients specifically. So if there's a family member who has an issue with someone within our agency, generally speaking, their best course of action is going to be with our customer service department versus Recipient Rights, unless it's a family dignity and respect issue. Then I'm able to do something with that. But most often our guardians, family members of the different recipients, whether they're on a release of information for the consumer or not, generally speaking, their best recourse for any issues they have is going to be with customer service.
All right, and when do people contact you? What part of that process?
What part? You mean like as far as?
Like if do they contact you? Something happens, or is it through the counselors, or how does that work?
It can be anything.
Okay.
So it can be the consumer that contacts me directly. It can be one of the caregivers that became aware of the information, even if they didn't witness it. They can reach out to me. It could be a community member. It doesn't have to be anyone specific. The only catch to that is, if you are a person who's dealing with substance use disorder, the laws around privacy for substance use disorder are a lot more strict. And so those individuals do have to participate in filing the complaint, because there's a release of information on their complaint form that allows me to investigate and talk to people to get more information about what happened.
So if you had to summarize your role and the role of West Michigan CMH when it comes to recipient rights, mm-hmm. what is that summarization?
I think it's best to look at it as like similar to almost an HR function, if that makes sense.
Okay.
So I'm there to make sure that our staff are doing what they're supposed to. That they're treating individuals the way that we would all like to be treated. And that extends to our contract provider staff as well.
Okay, all right. To make sure that obviously whoever walks through the door is
They feel safe,
Yeah.
and like their rights are going to be protected. I mean, it's in a hospital setting, it's a little more, I don't want to say it's a little more limited. They're limited to the departments that they're able to work with. So like if you were in a hospital setting and something happened in the ER, even though you're there for mental health treatment, that would be a customer service complaint versus a recipient rights complaint.
Okay.
If you were in a mental health unit at a hospital and something happened, that's going to be a recipient rights issue. The recipient rights department in a hospital setting is very much limited to the mental health unit itself. So,
All right. And overall, do you ever compare West Michigan CMH with other agencies across the state or some numbers and say, you know what, we're doing a pretty good job at making
Yeah.
sure that everybody is.
Yeah, I think we're actually doing a really good job. I mean, we're grouped with a region where there's CMHs that are larger than we are. They serve a lot more people. But comparatively, I would say that the number of complaints that we have is lower
Good.
than the rest of our CMHs in our regions.
All right, that's a plus. That's a good thing.
It's a good thing.
What's the? You said that before we went on the air, you're kind of a one-person team, right?
Yeah, I'm kind of a one-person team. Our recipient rights advisor, Anissa Goodnow, she's our network coordinator as well, so that's her primary function, but she is there to back me up. But yeah, generally speaking, it's me.
All right.
So.
But that's a good and a bad thing. The good part about that is that you don't need a ton of individuals within that department.
I don't have to supervise anybody.
Exactly.
So.
Well, and that there's not a lot happening where
Right.
where you have to take
Exactly.
action from your
Yeah,
from your
it's a good
position.
sign.
Yeah.
It's a good sign.
Absolutely. Anything we missed talking about this morning in regards to recipient rights?
I don't think so. I guess I just want to make sure that everyone knows that I'm there, and that if they have any questions, you don't only have to call me with a complaint. And this extends to staff, community members, whoever. If you have questions about something, I'm always happy to talk it out with you and help you figure the situation out. And if it's something that I can look further into and do something about, I will. If it's not, I'll help guide you to someone who can.
You got it. All right. Well, we appreciate you, Kara, for coming in and doing what you're doing. Not necessarily wearing tons of hats, but wearing a big hat to
Very
make sure that
specific
everybody's
one.
covered.
Yeah.
Exactly. Well, we appreciate you coming in and thanks for taking the time today.
Thank you. Thanks for having me.
Absolutely. It is 8:28 now on 102.7 WMOM. If you missed the segment, you can check it out on our Facebook page or our YouTube channel at any time. But also make sure you check out West Michigan Community Mental Health, their website, and as well the toll-free line. Do you know that toll-free line off the top of your head, if you don't mind?
I have a note.
Okay, yes.
It's 1-800-992-2061.
All right, and that's open for anybody out there, Mason Lake, Oceana County specifically, to if you need help 24 hours a day, there's somebody there on the other line to walk you through that moment of crisis or concern, or if you just need that other person to talk to. So good thing to have here in our community. Thank you for coming in, as always. We appreciate you.
Thanks for having me.
As mentioned, 8:29 now on 102.7 Bomb FM. Stick around. We've got more on the way, including Luke Combs' #1 song of the country. That's on the way next on 102.7. It's Bomb FM.
The 4th of July is a significant day in the United States as it